Are you ready? So let's move to the technical plenary session from now. So it's my great pleasure to invite first speaker of the plenary session. First speaker is Professor Muhammad Nashiruddin, PhD. Please join me in welcoming Professor Uddin to the stage. Professor Uddin, please. Okay, so before beginning his presentation, I would like to introduce about Professor Uddin. He is now in the Texas Agriculture and Medical University, USA. He was graduate from Biochemistry and Molecular Biology, University of Dhaka, Bangladesh, in 1919. So he got PhD from Gifu University in 2000. And his main topic is public health and disease. Okay, so if you are ready, please start your presentation. Are you okay?
Yes, sir.
Okay.
Yes. Good morning, everybody. It is always nice for me to return back to Gifu University as the alumni of Gifu University, though it is the more than 30 hours flight from USA to here, but I'm always feel good to when I come to see my alma mater, Gifu University. So thank you very much, the organizing committee, especially my longtime friend, collaborator, Dr. Kumaria, for inviting me uh, to give a talk on this climate change conference. So whenever we discuss, so we realize that the climate change is not it go its own. It is related with the plant and with the health. So mainly in my presentation, I'll concentrate on how the climate change impact the health and well-beings. So let's start with I'm giving a little bit of my where I am at. So I'm in the Texas A&M University Medical School. Usually I teach the medical MD students, and I have a lab over there. Dr. Dr. Kumaria visited, some of them are visited too over there. Dr. Mitsunaga Sensu also visited my place. And then next slide, please. So, it's not moving. Okay, and then I have a dual role in the university. I'm also serving as a research director for the medical student and residency and fellowship program. My research is on the disease of the public health interest, and which is funded by National Institute of Health. So this is my office here so that is one office, and another office is more than 100 miles apart. So in Texas or USA, this is very usual. So, and then Sorry, this having. Okay, sorry. Okay, you know that today is the election, done the election of the US election, right? So all over the people, all over the world is looking forward to the result for the election, right? So I start with some campaign from two potential presidential candidate of US presidential. No, so one is the Kamala Harris. So her campaign, uh, she asked the Americans to become unite. It means that people are not unite about the uh, environmental health issues. She asked for unite and for build the historical work in the advancement of the environmental justice, protect public land, public health, increasing resilience to climate disaster, and continues to hold um, polluters accountable to secure the clean air and water for all. So it's very straightforward that there is a problem there till in the one of the the toughest country in the world, they are struggling for the unity for their climate change problem. Yes, sir. I'm sorry. Okay, it's okay. Okay, and then President Donald Trump, he he just criticized the unfair Paris climate accords and opposed the radical left Green New Deal. You all knows that those who are in the environmental health specialist. Uh, President Trump, he called climate change a hoax, is a horrible situations or been a nightmare. He repeatedly used the word to describe the global warming on the social media platform X when he started in 2015 speech. He called global warming is a money making industry. So the money making industry, it means that there is a conspiracy there till policies and everything, right? That's how the scientists all over the world show their research research output showing the adverse um, effect of the climate change on plant, and obviously and is the human health. Okay, then I would like to go with some quote from some the notable people. If you just started with the former executive director of World Health Organizations, Dr. Margaret Chan, she remarked that our ruined planet cannot sustain the human lives in good health, right? So a healthy planet is really a healthy planet, and healthy people are a side of the same coin, right? So Linda Rodloff, who is the director for the Climate and Public Health Institute, U.S. Climate and Health Alliance, she quoted, "Human need clean air, clean water, safe shelter, healthy food, and a stable climate for survival. We cannot have healthy people without a healthy places on a healthy planet." Ban Ki-moon, you all know him, just recent past Secretary General of the United Nations, he quoted, "Climate change is intrinsically linked to the public health, food, water security, migration, peace and security. It is a moral issue. It is an issue of the social justice, human rights, and fundamental ethics. Albert Einstein, long before, as a theoretical physicist, who uh, quoted, "The world will not be destroyed by those who do evil." So it's the philosophical terminology, right? So somebody is doing the evil behave for the climate change, right? And one of the business magnate and then executive of the Apollo Hospital in India, uh, she is very much positive that we are in bad situation on the climate problem, but it is not going to defeat us. We can overcome it. That's why we are here all today, right? Okay, you see that uh, the intersection of the climate change and health is a uh, pressing concern that exceed the environmental boundaries. As our planet undergoes unprecedented changes, the implications for human being are profound and far-reaching. So my talk aims to unreveal the intrinsic relationship between climate change and health, exploring how these dynamics manifest on a global scale and impact individuals and communicate alike. So the next 10-15 minutes, I'll discuss on that. So as we know that in schematically, we started with the climate change impact here is directly impact on the human health, causes the injuries, death, thermal stress, infectious disease, okay, infectious disease, malnutritions, mental stress, and multiple other disorders, health disorders. And indirectly, it causes the physical system, river flow, ocean temperature, soil, and then also affect to the biological and ecological process, the plant, the crop yields, insect range and activity, etc. So which in turn affect to the socio-economical structures, affect to the jobs, uh, conflict, and which obviously the end product is the human health, is affect to the human health, and then that all the ends with the adverse effect to the human health. So this is what in schematically, if we present the climate change and effect on the human health. Key impacts that we discuss in this schematic diagram: heat stress. You know, the heat stress can causes the uh, heart disease or some other diseases for elderly and young people, and breathing problem, respiratory problem. So you know that if the polluted air can causes the pollutions, causes asthma, and then infectious disease. Uh, Infectious disease, you know that COVID-19 is one of the example for us, which pandemic, which radically changes our human health all over the world. So, and then waterborne disease. So then global warming or the warming of the temperature of river, ocean can cause the growth of different microorganisms, and then it passes some diseases, which is the waterborne disease. Sorry. Right. And then it causes these all are the direct effect, right? So directly it affects to the health, uh, respiratory system. Indirectly, it can cause the food insecurity. Uh, Food insecurity means then what is a lot of droughts and flood can lead to the food shortage and malnutritions. Mental health stress, whenever you do have uh, the environmental health can causes the stress, anxiety, and the strained social cohesion and access to the healthcare. Economical impact, which damages to infrastructures and livelihood due to extreme weather, even can lead to the economic hardship, further impact on health access. I'm giving some real life. So is the again exposure, adaptations, vulnerability, and health outcome. So they are all interrelated, right? How much you can adapt, how much are you are exposing with the environmental extreme environmental conditions, how sensitive you are and vulnerable you are, that causes the it depends on that all the health outcomes, which is with the death event, hospitalizations, mental health, physical trauma, emotional distress, injury, chronic disease. Does all of this happen for the for due to the changes of imbalance, right? Imbalance of the uh, you know climate change, environmental health. So mainly, if you can define it, the environmental public health is one of the burning topics nowadays. Environmental public health. So that is under the environmental public health. So if you see here, this is very clumsy diagram. If you can see here, the increase in climate impact, for example, the dramatic spike in ocean temperature, top right, ocean temperature, if you compare for 1982 to 2023, how it increases, right? And then top left, and if you see the collapse of the polar ice in the lower left, uh, coincide with the rise in eco anxiety systems amongst the younger populations in the top right. You see how it increases, and then in the if you see in the uh, right, the bottom right, where is the Philippines and India, those countries. In fact, three-quarters of the young populations are somehow uh, affected or being traumatized by the climate change. As you know, that they have been growing with this one, with this seeing the changes, so they are traumatized. So uh, is not how is effect, the indirect effect, what is I'm explaining here. If you see here, I'm showing one of the slide from my own the country where I'm from, Bangladesh. If you see that, this is the southern central part of Bangladesh. You see, there are been is in the Gulf. It is the Bay of Bengal. So Bay of Bengal, you see nearby that you see that you see the people and then the animal. So all are being in danger, right? And then it's happened for the food and water insecurity. So that causes the trauma, and then eventually that lead to the adverse outcome. So if you do not have the sufficient opportunity, you don't have the environment, even at your home, if you will not give a good environment to your children, they will not grow well. Their mental health will not be good. So you should be careful on that one. So globally, now the countries like the underdeveloped countries, they're mostly affected by, directly affected by the environmental changes. This is one example of my back home country, Bangladesh. And then is the Indonesian, and then the some other countries like the South America. I have another slide for. Sorry, I'm not good at that. You see that Spanish word which is called the El Nino, the which is the warming of the ocean surface, which the temperatures is the Indonesia descending dry air, and then the South America, and then it causes the warming and like the rising moisture. I know that last year I visited Indonesia. It's very moist, right? It's very moist. The climate is so. This is due to the there where they are at, right? So people adapted, people adapt, but there is a long-term effect is there. The productivity of the people may be much are much better than now the situation is right now. So I need to. I'm taking a lot of time. So that's why I would like to go a little fast. You see that the how the disasters. The red one you see that is highly affected is of the some of the study of the Catholic University in Belgium. So number of the victims uh, is been increasing. Environmental health. If you see here, the temperatures how it increases, and their mortality, is been going high. Okay, so now we've been going through the direct effect on the climate change, on health risk. You see the vulnerable factors or the demographic, geographical, biological factors, socio-political, socio-economical, healthy system capacity, and gender and equity, which is causes the health risk. What are the extreme weather, heat, sea level, air pollution, a vector contributed for the microbial disease, water scarcity, reduce the food productions, which exposure can causes the health worker and energy system, infrastructure, health system. However, you see that it rises from the health system and facility. They emitted the uh, greenhouse gas. So, and that causes all this effect, right? Increases this one. However, and health outcomes is there. So, how you will consider this one? How we can interrelate this one? It means that we should minimize. Uh, sorry, we should minimize the health system, health facilities, the emissions of the gas. We need to be careful how minimum gas we can uh, the industry, healthcare system, pharma, the emissions can be reduced. Then this whole system will be. That's what I showed that it's been happening and causes all the health hazardous. And then aside by that one, the health system is here. So, but they are causing you to come to the hospital, right? So that's how I started with the two presidential candidates uh, election campaign, right? So that is some politics is there, some business is there. So we need to minimize that one. That's how we need to become with. I'm how many minutes I have? I'm fine. Okay, thank you so much. Okay. If you see that climate driver, if you see here, I'm sorry, this is very in busy. You can see that one, but if I can just make it very simple, that extreme heat can causes the rise in temperatures and will lead to an increase in heat-related death. Outdoor air quality, which causes the asthma and then some other airborne diseases. Flooding, as I showed that in Bangladesh or countries like that, the flooding can cause the socio-economical and mental stress, and then um, increase uh, the anxiety for the adult and young adult, right, about the 18 years, they have been mostly affected on that one. So vector-borne infections, as that you see that we know that the microbial diseases, they are being uh, transmitted through the vectors. And water-related infections, when the water is warm up, some microorganisms, they reform, they mutate, is that like the COVID-19 coronavirus, it is been due to the people believe that this is the global warming. The some of the virus is, the swan virus is mutate, and then it's made a very virulent uh, strain. And now it's changing now, that what will coming next, we don't know, because we didn't control the global warming, and then spontaneously it's muted. Okay, so that is something like the increased global temperatures, extreme weather, so changes climate, which are the factor precipitations, extremes, sea level rise, change in land use and growing the seasons, and which extreme heat, it's called extreme heat, air and water pollutions, reduced food and water quality, and sea level, which changes the infections, as I mentioned right now, and then the changes in land use, which causes the increase in the allergens, the allergens, which causes the multiple diseases, and then health impact. So heat related illness, cardiovascular problem, injuries and death, mental and neurological disorders, and respiratory disorders, and how we can intervention strategies. I'm giving a little bit here. From next few slides, I'll go over with how we can mitigate or adapt this one, and what public health policy we need to be implicate for these remediations. So, as if we would like to see the how it can causes the global health crisis. So we discuss how it impact to the health, but is the global health, how it the environmental change, or the climate change, how it changes the uh, global health and raises the global health concern. The climate change exceeds the traditional categorizations as an environmental challenge emerging as a difficult global health crisis, and it intricate interplay between environmental shift has been shifting from one level to another level, and create a complex that poses the unprecedented challenges for healthcare systems worldwide. Extreme weather events, including the hurricane, droughts, and flood, resulting from climate change, not only causes the immediate casualty, but it has the long-term effect, long-lasting effect. These altered ecosystems can delicate balance, so disrupt the delicate balance, the biodiversity, exposing the population to new vectors and disease. The transformations of the agriculture patterns contribute to malnutrition and food insecurity. So, is immediately climate change causes the mental health issues like the anxiety, uh, post-traumatic stress, and long-term disorder due to the factors like displacement, and disrupted social cohesion. Is the climate risk? As I say, these are all the factors, and then it causes the health impact. So this may be the respiratory, infectious, neurological. So I'm just breaking it down trying to make in a funnel, for the bigger funnel, to making this to be some point. Then we can discuss a little bit how we can mitigate and adapt these issues. So as you see that the diseases is mostly being, we know that genetically involved food is there, but different effect, but the environmental health changes causes all of the changes. It can causes all these disease. Okay, so you see that the physical environment is a threat multiplier. It means that it can multiply. If you have the more than one factors, the risk will become multiply, right? So if you have the one factor, is a normal mathematical terminology, right? The one factor, if there's a two factors, three factors, is multiply the risk. So this is how the different factors, if there is a factors uh, like the warming of the water, sea level, and other factors, it multiply the risk factors also. Okay, that is the same rising of the multiply. So I don't like to go in details on that. Okay, now the holistic approach, which I started, what is the holistic approach? How the multidisciplinary actions needed to address the environmental change, or environmental uh, effect on the human health. How holistically we can combat that. So first, we can start the mitigation strategies. What is the mitigations? Reducing the greenhouse gas. We all know that, right? So emissions through the transition to renewable energy source and sustainable practice to limit the severity of the climate change. So do you have any ideas to how we can do that, right? We cannot do it in one, but there should be some policy. So if you can allow to use some of the things, right, you can tell you reduce, right? You can have some rules, some policy making, and some level, governmental levels. So international levels, so some advocacy committees there, they're trying to see for the public health issues. So it's a big public health issue. So environmental public health, as I mentioned to you, there is a lot is going on that, because that is the burning issue nowadays for address the disease, and to keep to uplift the some the burden, economic burden for the public health issues, to address the public health issues. So if you see here, the mitigations, transformation, and adaptation. So you can see the low carbon level, recycling, and virtual and digital care delivery. So you have no need to go to the doctors. You can do nowadays is COVID. That mitigated some of the health. Doctors. You can now, I don't know, here in USA, so you can go to the online to see the doctors in online, right? Mitigate, and then this way maybe you have no need to drive, so no need to emit. Now they have the car. So Elon Musk had the Tesla. You know that it's been there too. So and then but again, his battery is very dangerous, as I know that. But they're not trying to see how they can do that. This all are the policies we need to be made, and adaptations. Early warning system. So we have these early warning systems. So for developing a system to alert communities about upcoming extreme weather events. It's been going all over the world. Maybe now they have the early warning systems, heat adaptations plan. You need to how you can adapt the heat. So and then campaign is needed for to make the public awareness, improve the healthcare infrastructures. So healthcare infrastructures providers should be strengthen their healthcare system to respond to the climate related health emergencies, right? Not only the chronic diseases, but also the health, climate change related uh, healthcare health emergencies should be considered as a emergency, and then it need to be aware of everybody. And community resilience building, so which is empowering the communities to prepare for and recover from climate related disasters. So intersectorial collaborations. That is, I'm now narrowing down it all this effect, but intersectorial collaboration means we need to make the health sector engagement. So that should be okay. Somebody didn't mute, right? So integrating climate change consideration into healthcare policy practice. So healthcare engagement, collaboration with policymakers, advocating for policies that address the climate change and public health. So you need to be protect the public health. Community outreach. So you need to educate the communities about the health risk for the climate change, not to use it, social and physical environment, and promotional models. The promotional models, you can see the one sector invest in another sector to address factors that impact on own outcomes. Executive leaderships. So there's I started with a uh, few quotations from some executives from different organizations uh, that we should follow that, right? That's why I started all these points and ending with the how we can address them. Yes, we should address them. So, at the policy level, uh, urban greening, obviously. I saw in last year when I visited Indonesia, there is urban, so they're doing a lot of the green and the lot of tree is there. So that is good. Otherwise, the warming is should be more, but it's been going on. But it should be all over the world in the developing countries and focus on the SDG. So you know that I don't like to go in details, but you all know the SDG, right? 17 point. So one of the point is uh, uh, the environmental sustainability, economic sustainability, and social sustainability. Is the SDG is one of the goal. So we need to meet the goal for SDGs. Dr. Kumaria and those people in the this conference, they are really trying hard to reach the goal for the SDG goal for the environmental that sector. If the 17 points. So, okay, I'm going a little fast. So, and then political mandate, as I saw that both of the presidents, I know that by these two today before noon, we'll know who will be the president of the United States of America. They can come up with the campaign they started with the first of March. They should come up with, obviously, they said in the campaign, they should implement it for the political mandate, right? So they have the political mandate. So I don't, for the Danubia, this is one of the basin in Eastern Central Europe. So that is been one of the model utilized for the modern world for the climate change, to testify the climate change. So that uh, they are working the way for making the stakeholders how to address the adaptations and mitigations. Okay, a key point we need to consider. I'm about to be finished. Two more slide. Sorry, one more slide and last one slide. Right. Vulnerable populations, right? What are the vulnerable populations? So those who are elderly people, who have the underlying, conditions. So you need to take care of them and not to expose them for extreme weather conditions. Mental health conditions, you need to recognize the significant mental health impact on climate change and provide access to mental health services. You need to be give the mental health services, and then the another one health approach. How many of you know the one health approach? The students, not the faculties. You know, right? So, what is the One Health program? You know the One Health program: health for plant, health for animal, and health for human combinedly. So you can make in a model, you can address all these diseases by one health problem, one health. If there is a veterinary scientist here, veterinary scientist is one of the key factors, key component for maintaining the um, one health uh, address. So you can one health. So if you take care of the uh, plan health or the animal health, then you can address the same way you can address the human health. So this is my last slide, policy. So I don't like to go in policy, so I would like to happy to be. So I can end up with the slide. There is no planet B. So it's only the planet A. And then think green, live green, fight global warming. Thank you very much for listening. And then
Thank you very much, Professor Udin. So actually, so I forget to take the break after photo session, so you have enough time.
yes, I have enough
So
time.
now, now we can accept your question and comment from floor. Are there any comments? Okay.
Thank you so much. I appreciate for your presentation. I also interest with your climate change health impact pathway, Mr. Nasaruddin, Professor. Development with the pentahelix model involving the government, the private sector, private university, and mass media, also all people. But has this model been implemented and to accelerate the better situation? What is your suggestion? Because it involves various parties, also sector. Thank you so much.
yes, thank you very much. This is the last things which I am trying to address that. So model is there, stakeholders are there, and they are acting over there. But you know that something is over there. So which is the politics, global politics, and then the business is there. So we need to be bring more the stakeholders for businessmen for some, all the billionaires should come, all the healthcare sectors, the owners, and they should come forward, and pharma, they should come forward. Obviously, policy making there for the implementations of that one, right? And then only that can be implemented.
Yes, thank you so much.
Okay, thank you very much. So as any comment, I can accept one more short question.
Yes.
Okay. Okay, Zoom guy, please. Just a moment.
Mr. Azman Hossan. Sorry, I don't know how to. I think we should stop screen.
Yes, so yes.
Hello,
Yes.
Please,
Please, we
can you hear me?
you. Is a midnight. How about the election?
It is
Please.
going still well. Thank you so much, Dr. Nasiruddin. I'm so glad that for your well-organized and thought-provoking presentation on the connection between climate change and health. And my name is Azman Hossain. I was supposed to be there, but unfortunately, due to a family emergency, I canceled my trip. And currently, I am joining virtually from Colorado, Texas, Colorado, United States. So I would like to thank you, Dr. Nasiruddin, for your well-organized presentation. And I'm so glad that you brought a holistic approach in dealing with the connection between climate change and health. I know you are a medical professional, but you navigated how the socio-political and economic aspects can interfere in the connection between climate change and health. So I have a questions like you have a wide varieties of experience in your research and academic career. You are from Bangladesh. You did your PhD from Japan, and now you are in the United States doing research and teaching medical education. So whenever we are talking about like socio-economic aspects of health, if we look at the United World Health Organization's health definition, health is a state of complete physical, mental, and social well-being. So given your experience from Bangladesh, then Japan, and then United States, uh, how do you see the differences that how our socio-economic and political aspects are affecting the connection between climate change and health? Specifically given the history that USA is a highly racialized country, but in Bangladesh, race is not an important factor, but it is highly unequal country in terms of income, in terms of socioeconomic like status. So how do you see the difference between different countries?
Okay,
Thank
thank you, Dr. Hussain. Thanks. You are being it's midnight your place. You are being wake up and then you are listening to us. So yes, I agree because I have the diversified experience to be being in Bangladesh, Japan, and USA. So, the first, I know that I need to learn from you. I know that you are a specialist on that field. So, sustainable environmental health and then policy. Uh, we wish you could be here. We have more discussions. But for my layman, uh, the layman on that field, I can tell you that one thing is the difference of the insurance is a big factor, right? Insurance is a big factor. Healthcare, people cannot go to the doctors, cannot get the good healthcare. Uh, Obviously, this is one of the factors for economical standpoint, but social standpoint. So, if I went to Indonesia, there is a lot of tribe is there, right? So that is whenever they have the if you consider their general health is different from one race to another race. Uh, if I say exactly for Bangladesh also diversified. We have different people came in. We are being also for Japan is really the I tell that is a monoclonal, right? So they are all look similar. They are all same. So their health problem are same. So they are healthy and they have their So and in if you like to write, if you come to the global aspect, you cannot combine these three parameters. You need to set different parameters to address these different type of countries. That is what you want to, maybe I can, okay, you want this answer or
Yeah,
you want more?
thank you, sir. Yeah, you responded
Okay.
very well. I
Okay.
really
Okay.
appreciate.
Okay. Thank you so much for
Okay.
listening us.
Okay, thank you very much for the due to the time limitation, we have to move the next speaker. But actually, so Professor Udin is a fellow of the American Heart Association. So I would like to ask what kind of what action are they taking American Heart Association for regarding the climate change. But time limitation, I will ask you the
Later on, right?
yeah, later. Okay.
But I just say only one word. American Heart Associations, they are funding for the public health issues. Any public health issues you go, this one, they're giving the funding for doing the research for that one, right?
Okay, thank you very much. Due to your active discussion, so we can catch the time. So please give applause again. Thank you very much, Professor Udin.